10% of the country's GDP. That story right there by Brenda Kerubo now sets the pace for our discussion today. I'll be speaking to the CEO of Kenya Hotel Keepers Association, Mr. Mike Macharia. He now joins us live from our studio here in Mombasa Road. Sir, good to have you on the show.
Yeah, thank you. Thank you for having me, Ryan.
Let's first start by taking stock of how the hotels have, coped up with the regulations that are provided by the Ministry of Health and by extension also the Ministry of Tourism. What has the experience been like?
Thanks a lot. You remember we started developing these protocols last year, and we launched them beginning of June last year. And we went ahead as the industry to invest a lot of money in new facilities, new wash basins, sanitizers, new operations of guest bedrooms where you had to empty, once a guest left, you had to keep the room free for 24 hours so that you can sanitize and fumigate and everything. So we did invest a lot of money in protocols. We also did invest a lot of money in the staff, whereby we paid for the testing of staff regularly as we came back to normal. Now, what has changed between then and now is the vaccine rollout. And this is why you found that a few months ago, we were fighting to be categorized as essential services workers so that we can be able to roll out the vaccine in our places. Fortunately, we got a number of vaccines from the Ministry of Health, and we've now managed to vaccinate a good number of hotel employees, a good number of tour operators, a good number of tour guides, and a good number of drivers. So, and the main reason for that was to have a protocol that would be safe right from the airport all the way to the van, to the safari destination, to the hotel, and back, where all the tourists are being serviced by people who they feel are safe to service them, because we were expecting that the tourists would be arriving with either a PCR negative test or double vaccination, and they also expect to be served by people who are vaccinated. So that's where we are. We've really invested a lot, and we were just beginning to see a bit of activity coming back, particularly at the coast and Naivasha, a little bit of activity in Nairobi and the Machakos area. And we were hoping that we'd be able to continue with this. That's why we got together again with the Ministry of Tourism through CS Balala and revised that document. It took us exactly 24 hours to propose revisions into that document, and they were accepted, and it is what was launched a few days ago.
Great, quite some ground covered right there. So let's also look at the flip side. What are some of the challenges that the industry players have faced, while they want to comply with these regulations?
Compliance for us, Ryan, is not a very difficult issue. Okay. Because what we did, again, we got together with the Kenya Healthcare Federation, and we ran a number of training programs within the industry. We got together again with KEPSA and did another round of training programs. So, and generally in terms of hygiene, because our business dictates that we must have very high levels of hygiene. Sure. It is not very difficult for us to comply. The challenges are actually macro. They are not from within. The challenges are external. And the external challenges are mainly to do with the unpredictability of government announcements, unpredictability of the lockdowns, the unfairness of the application of the lockdowns, and the unfairness of certain European destinations like the United Kingdom imposing travel restrictions into Kenya when their people want to travel. And you find that they've, for example, today morning, we got a new amber list. Kenya is still on the red list. So obviously, if you're traveling from Kenya to the UK, you would be required to quarantine in a hotel that was costing £1,750, but now it's going to cost you £2,200 and 2 weeks of your time in a hotel in the UK. The irony is that you have countries such as Iraq, Chad, Afghanistan on the amber list, and you're wondering, what exactly is the criteria? Is it really a scientific criteria, or is it a political criteria?
A blanket one, sort of.
Our president went out there. We were hoping that he would come back with some good news, and they went and insulted our intelligence by giving him a toy car instead of addressing the issues, the real trade issues that we want addressed. So our challenges are mainly macro. You saw that I think it was on May 1, just before Easter, we were ready with our businesses to go full blast. Then the 5 counties were locked down. They were reopened on June 1. Again, last Friday, the CS Health made a raft of announcements, and these announcements were restricting meetings generally. Now, it is not clear what sort of meetings we are talking about here, because it says public meetings and public gatherings.
Wow.
Then it says churches can meet. So are churches public gatherings? And then it says political gatherings are prohibited. From the time of that announcement, we have counted 7 political engagements between Friday and today. And nobody is stopping those. But it's, it seems like there is this fixation with stopping our industry from operating.
I hear you. I hear your concerns. So let's talk business now. And you mentioned earlier on about the sales and the volumes of sales. I want to now just take stock also, before the lockdowns happened and before the closures were done on restaurants and hotels, and now that at least they've been eased, there's been a bit of easing by the government and opening up the business environment for the hotels to operate. How are the sales faring on? Are we catching up? Or is there recovery? Are we breaking even? Or it's total doom for the hotel industry?
The best thing that happened on June 1 was when the president made an announcement, and he was very clear that the tourism industry should follow its own Magical Kenya Travel and Tourism Safe Travels document. And with that, then, we were able to go out marketing. We got together with the tourism board. You've seen a lot of messages coming out of the tourism board. We did joint promotions together with the board, and we started seeing people actually taking up holidays, taking up meetings. The government itself is the biggest supporter at the moment of our industry, because they're holding all their meetings within our premises.
Wow.
And this is part of what the president gave last year as a stimulus package when he withdrew you remember the Modaura circular that was prohibiting government agencies from holding meetings in hotels. So that was the best thing that happened at that point. And we started seeing people coming back. We started seeing even interest from external markets. Just last week, we received a new aircraft into Mombasa, Eurowings, that will be bringing at least 130, 140 people on a weekly basis into Mombasa. We are looking at getting Qatar Airways back with the big Dreamliner, and we are looking at Turkish Airlines and Ethiopian coming back into Mombasa. So we had started seeing some hope and some recovery taking place. Again, the Kenyans were really traveling. So when we count, as a physical count up to June, I think we had about 300,000 foreign travelers into the country. And a similar number of domestic travel, which means that domestic is really supporting us. But the main area of business is meetings and holidays.
And mice.
Yeah.
Mice tourism.
Yeah, mice is what I'm referring to as meetings.
Great.
Yeah, so we have meetings, we have incentives, we have conventions, and we have exhibitions.
Amazing. So I want us to play a story that is going to set the pace for the next question I'm going to ask you about vaccination. And the private sector remains very optimistic that collaborating with the government will effectively boost vaccination across the country. And as Noah Kipkimbo reports, sector leaders are willing to fund procurement of vaccines if it means fast-tracking the reach of herd immunity. Take a look.
In an effort to strengthen the fight against COVID-19 in the country, the private sector is now ready to work with the government to procure more vaccine doses.
The procurement is strictly under the guidance and the protocols of the government through the Ministry of Health. And I am repeating this because this is not just another product. It's not another pharmaceutical product. These are unique products that impact on the lives of the Kenyans directly, if mishandled and if the process and the protocols are not followed.
Procurement by the government is due to accountability.
Just imagine if we had a vaccine that is not approved in the country and has not been handled the way it's supposed to be handled, and it comes and it's injected into 10,000 or even one Kenyan, and they lose their life. The key responsibility of that, the responsibility and the blame will go to government. That's why they're managing that, and it's in order, and we really support that kind of arrangement.
The current state of the global vaccine procurement is government to government or government to business.
I do not foresee a situation where government will allow any of the other private sector players to directly procure this. I do not see that's happening soon. But after some time, when it's now established that we have reliable and credible supplies, and we have to get this produce or this product from this and this, and the protocols and criteria and the specifications are very clear, then the other players who are in that sector are able to be allowed to, but with strict, of course, observance of the protocols and guidance that is given.
One tenable solution by the private sector is producing vaccines within the country.
Setting up a vaccination plant in the country is possible. And I know we have about 27 or thereabouts big pharmaceutical companies in Kenya. And some of those diversifying to do vaccines is not very difficult, but they have to work very closely with the parents, the owners of the brands, because there are rights involved. And I foresee Kenya not being left behind.
The private sector involvement is said to help the government achieve the 10 million Kenyans being vaccinated marker by the end of the year. Noah Kipkimbo, KTN News.
Fair enough, my colleague Noah Kipkimbo, thank you for that report. That now sets the pace for the next question, which will also culminate our conversation here on recovery of tourism industry. Mr. Macharia, I want to just ask you, with regard to Noah's story, what is the role of vaccination in enabling the tourism industry to recover fully? And do you see a situation whereby you're going to have, a boost in the domestic travel?
Ryan, vaccine rollout is the key. And we said this a few months ago when we said we need to roll out vaccinations in Kenya. And the scientific information we've gathered from our colleagues at the Ministry of Health is that a vaccinated person has less chances of falling seriously ill and landing in hospital. So, and that's one of the problems that we are seeing. If we don't continue with the rollout, then we cannot be able to guarantee the safety and health of most of our staff. Great. And by extension, the tourists. So it's very, very important. And we are part of that conversation. When Noah talks about the private sector under the umbrella of KEPSA, we are also part of it. We are also part of helping the government to procure vaccines. And we are ready to pay for those vaccines for our staff. So it's a very, very important step. Even as we wait for the medical world to look for a cure, the quickest mitigation is rollout, and we try and get as many people traveling within the country, and then attract also our external people from the key source markets.
Great, and I think what we are getting from your sentiment is that health is now part and parcel of business by and large. Many thanks, Mr. Mike Macharia, for speaking to us. We have been speaking to the CEO of Kenya Hotel Keepers Association. He has been talking to us about the state of the tourism industry and what it would take to have a recovery in amidst the pandemic. We are now due for a short break. We've got to pay bills and pay our taxes. You're watching Business Today on KTN News. Do stay with us. When we come back, I'll be telling you why you should be caring for chicken, for poultry, and why chicken welfare is important to you. Stay with us.